If you have tinnitus and hearing loss, someone has probably told you hearing aids can help. And maybe your response was something like, how does turning up the volume fix a ringing that's coming from inside my head? That's a fair question, and it points to a misunderstanding of what's actually happening, both in your auditory system and what modern hearing aids are actually doing.
If you're navigating hearing loss or struggling with ringing in your ears, then you've come to the right place. The All Ears Hearing and Tinnitus podcast is your go-to source for expert insights, real stories, and cutting-edge solutions in hearing health. We'll dive into the latest advancements in hearing healthcare, explore groundbreaking treatments for tinnitus, and offer practical tips for better hearing. Here to help you tune into a world of better hearing, here's your host from Timpanogos Hearing and Tinnitus, Dr. Layne Garrett.
I'm Dr. Layne Garrett, founder of Timpanogos Hearing and Tinnitus here in Utah, and I've been treating tinnitus and hearing loss patients for over 20 years. Today, I want to give you a practical, honest breakdown of which hearing aids are actually performing well for tinnitus patients in 2026, what makes each one clinically different, who each is best for, and what you should realistically expect. Not a ranking, not a sponsored list, just what I actually see in my clinic that works. Before the device comparisons though, you need to understand the mechanisms behind this because it changes how you think about what to look for in a hearing aid. Tinnitus and hearing loss co-occur in over 90% of cases. When your auditory system stops delivering normal sounds to the brain, especially in high frequencies where most hearing loss begins, the brain doesn't just accept it, it compensates. It cranks up its own internal volume trying to fill in the gap. That hyperactivity is what most people experience as tinnitus. A 2023 study from Harvard documented this directly. Auditory nerve fiber loss driving increased brainstem activity, even in people whose standard hearing tests look completely normal. The brain was generating its own sound because it wasn't getting enough real sound. So when you put on a well-fit hearing aid, you're giving the auditory system what it's missing, that external sound stimulation to calm that hyperactivity. Not always immediately, not always completely, but measurably for most people. A 2023 study published in Frontiers in Audiology and Otology followed 40 patients over 12 weeks and found the median tinnitus distress score dropped from 49 to 26, nearly a 50% reduction. And that reduction built over time, which matters. Your brain is adapting, not just being temporarily distracted by masking. Now, none of this works if the hearing aid is not programmed correctly. I'll come back to that later, but it does mean that the hearing device features you're evaluating actually matter. Now, before I walk through these devices, I want to give you a simple way to think about them, because the right hearing aid for tinnitus isn't about which one has the most features. It's about which one matches what's actually driving your tinnitus distress. In my clinics, most tinnitus patients fall into one of four patterns. Their tinnitus is worse after a long day of difficult listening, or it's a constant and they need something to actively helping them manage it all day long, or it spikes specifically in noisy environments, or the tinnitus signal itself is the primary problem and needs precise, targeted therapy. Each of these four device maps to one of those patterns. So as I go through them, think about which one of those sounds like your situation. I'm going to start with the Oticon Intent. Its argument for tinnitus patient begins with something that doesn't sound like a tinnitus feature at all. It's exceptionally good at reducing listening effort. That matters because listening fatigue and tinnitus distress are directly connected. When your brain is working hard to try to understand speech, filling in the gaps and guessing at words, compensating in background noise, it stays in a high state of alert. That's the same state that makes tinnitus louder and more intrusive. Patients tell me their tinnitus is worst at the end of a long workday or after a noisy dinner out. That's not a coincidence. The Intent uses a deep neural network trained on over 12 million real-world sound samples. It's genuinely good at separating speech from noise, which means your brain isn't working as hard to hear, which then means tinnitus has less to compete with. It also includes a built-in sound therapy feature your audiologist can program to your specific tinnitus. I tend to recommend it for patients whose tinnitus is clearly worse in demanding listening situations. If your ears feel like they've run a marathon by 5 p.m., that's the signal I'm looking for. Now that approach works well when the primary driver is listening fatigue, but some patients need something more targeted. Their tinnitus isn't just a byproduct of a hard day of listening. It's constant and they need active sound therapy built around the device itself. That's where this Widex SmartRIC comes in. Widex has been doing tinnitus sound therapy longer than almost anyone, and what they've built is genuinely different from the white noise or ocean sounds you'll find in other hearing aids. They use something called fractal tones, random chime-like sounds built on a mathematical algorithm so they never repeat in predictable patterns. Now, why does that matter? Because your brain habituates to predictable sounds. Play the same white noise long enough, and your brain starts to filter it out, which is exactly what you don't want when you're trying to give it something else to focus on besides the tinnitus. Fractal tones stay novel. The brain stays engaged with the external sound rather than the internal one. Your audiologist can dial in the pitch, tempo, and volume to match your specific tinnitus profile, and Widex processes sound with near zero delay, which matters for patients who've tried other hearing aids and felt like everything sounded a little artificial. One note, if you've been reading about the new Widex Allure, it currently does not support these fractal tones. For tinnitus management specifically, the SmartRIC is the right Widex hearing device right now. I use it more for patients whose tinnitus is constant and whose distress spikes with stress and anxiety, and who need a structured sound therapy approach as part of treatment, not just amplification. Both the Intent and the SmartRIC address what happens inside the device and inside the brain. The Phonak Sphere Infinio takes a step back and asks a different question. Where is the tinnitus actually most disruptive in your life? For most patients, the answer isn't the quiet environments, it's the restaurant, the family dinner, the work meeting, where you come home exhausted and the tinnitus is screaming. Noise doesn't just make hearing harder, it triggers a stress response that feeds directly into the tinnitus. The harder your brain works to hear, the louder and more intrusive the sound gets. The Phonak Infinio Sphere uses a dual chip design, a dedicated AI chip running alongside the main processor, specifically built to handle noisy environments better than a single chip devices can. The reduction in real-world listening effort can be substantial. It also includes a customizable tinnitus masker for your audiologist to tune it to your tinnitus. If social situations have become something you dread because the combination of struggling to hear and tinnitus spiking afterwards, this device is worth a serious look. Where the Infinio Sphere excels in the environment, the Starkey Omega AI goes deepest on the tinnitus signal itself. Most hearing aids give you a few standard masking options, white noise, pink noise, maybe some nature sounds. The Omega AI's Multiplex Tinnitus Pro lets your audiologist tune the masking signal up across 24 frequency bands shaped specifically to your tinnitus profile. That precision matters for patients who've tried basic masking and found that it didn't help or actually made the tinnitus more noticeable by contrast. When the masking is matched to where your tinnitus actually lives in the frequency spectrum, it's a different clinical experience. There's also a companion app with adaptive nature sounds that extends the therapy beyond wearing hours, useful specifically at night when you've taken the hearing aids out and there's nothing competing with the tinnitus. Sleep disruption is one of the most common tinnitus complaints I hear, and that's a gap a lot of hearing aids just can't address. For patients where the tinnitus itself, not just the hearing loss, is the primary clinical target, the Omega AI gives me the most tools to work with. I want to be direct about something because the best hearing aid for tinnitus framing can set an expectation that needs some correcting. I think of hearing aids as the foundation of tinnitus treatment, but foundations have ceilings. These devices restore auditory input, reduce listening fatigue, and provide sound therapy options. And for most people with tinnitus that's tied to their hearing loss, that foundation alone makes a meaningful difference. But for patients with significant tinnitus distress, high scores on a validated tool like the Tinnitus Handicap Inventory, we sometimes hit that ceiling and need to look at what comes next. And that's where bimodal neuromodulation comes in. Layne is the only FDA-approved device of its kind. It combines sound therapy through headphones with a very mild electrical stimulation to the tongue at the same time, and that drives changes in how the brain processes your tinnitus. 2 peer-reviewed real-world studies have now been published about this. McMahon and Lim in Communications in Medicine analyzed 220 patients with moderate or worse tinnitus over 12 weeks. Nearly 92% of people saw meaningful benefit on the Tinnitus Handicap Inventory, and a second study by Casper and colleagues in the American Journal of Audiology, published in January 2026, analyzed 140 patients at a separate clinic and found 82% met that same threshold, which means that their tinnitus handicap inventory had significantly reduced. 2 independent research groups, 2 different clinics. Consistent results. Linear isn't a replacement for hearing aids. It's what we reach for when the foundation is solid, but the ceiling has been hit. And it's not appropriate for everyone. Patient selection and clinical expertise matter when you're talking about linear. Now, all of that, the hearing aids, the treatment plan, the outcomes, depends on one thing that most people never think to ask about. Industry surveys show that only 30% of hearing clinics routinely perform real ear measurements, which means if you walk into a random clinic, there's roughly a 70% chance that your hearing aids you're leaving with were never actually verified to work for your ears. Real ear measurements put a little probe microphone in your ear canal, and that confirms the hearing aid is delivering exactly what your hearing profile requires. Without it, you can have any of the 4 devices I described today and still not be getting what the technology is capable of providing you. So the 4 that I would point you towards in 2026, the Oticon Intent for reducing listening fatigue in demanding environments, the Widex SmartRIC for structured fractal tone therapy when tinnitus is constant, the Phonak Infinio Sphere when noisy environments are when the tinnitus hits hardest, and the Starkey Omega AI when precise, targeted masking of the tinnitus signal is the primary goal. The right one depends on your hearing loss pattern, your lifestyle, and what's actually driving your tinnitus. And a simple list doesn't answer that. A thorough evaluation, though, can. Drop a comment. Which of these patterns sounds most like you? Or what have you already tried for tinnitus relief? That helps other viewers sorting through the same questions find their own answers. For more on evidence-based tinnitus treatment, from hearing aids to linear to cognitive behavioral therapy, our Learning Center has detailed resources. A link is in the description. And if you're here in northern Utah and want a tinnitus evaluation that goes way beyond a standard hearing test, including tinnitus assessments and real ear measurements, you can schedule in one of our clinics. You can find a link to do that in the description as well.
A world of better hearing and relief from tinnitus is within reach, and we're here to help. Be sure to subscribe to the podcast right now and join us on the journey to clearer sound and a richer life. Thanks for listening to the All Ears Hearing and Tinnitus podcast with Dr. Layne Garrett. We'll see you next time.